For today's topic, I would like to share our preliminary work regarding the control release of doripenem by using the montmorillonite. So in this work, we use the montmorillonite as the vehicle for loading the doripenem. It is a antibacterial drug which is usually used for treatment of lung infection. Okay, so for the control drug release, of course, we know that it is important because it can improve the efficacy of the treatment. That is by reducing the concentration fluctuation of the drug during the administration. And another importance of the control release is that we can improve the bioavailability of the drug, where it can help to prevent the premature release of the drug itself, and of course, preventing the premature degradation of the drug before it can reach the target. So by using this control release method, we can also reduce the concentration of the drug to be administered by the patients. So we can maintain the concentration of the drug within the therapeutic range. So it can reduce the side effect of the drug to the patients. Okay, so for the control release, we need the help of material which is known as the drug vehicle, where this vehicle usually made from the natural polymers or any other materials which is inert to the cell. So so the vehicle should not have any side effect to the cells, and we can see I have listed some of the common drug barrier over here. So commonly we can use the natural polymers itself, and then polymers and the composites, and then nanoclays and solid lipid nanoparticles, and also dendrimers. So because the vehicles along with the drug will be consumed by the patients, and it will enter the patient's body, so it is important that we make the vehicle to be safe, biocompatible, and non-toxic. Okay, so we can either use the vehicle which can be degradable inside the patient's body, but it should not have any effect, or we can also use the vehicle which is non-biodegradable, which is one of which is the nanoclays that we use in this study. Okay, so we choose to study the potential of the clay minerals, for the control release because of several beneficial properties of the clay minerals itself. That is the first one. We know that the clay minerals they are inert, and they have thixotropy activity. So these properties of the clay allows it to not react with the cell tissue, but it can change in the viscosity properties depending on the shear stress given by the body fluids. So these clay minerals is a very potential drug vehicles, which can be made responsive to the shear stress of the body fluids. And then because the clay mineral is natural, it found that these clay minerals also have no or low toxicity to the cells. So these properties make it potential for the biomedical application of the clays. And also we have seen in this recent year, the nanoclay minerals have been used as the drug vehicles for variety of drug delivery. Yeah, because it's found to have good biocompatibility with most cells, and also it have high porous surface area, which make it potential to be absorb many drug molecules, so it can have a high loading capacity of any drug molecules. And also it can be easily modified, so that we can modify the surface charge of the clay, and it can have a higher loading capacity of specific drug with the opposite charge. So yeah, so the clay is also easily to be modified. That's why it makes this material is interesting to be used as the drug vehicles. Okay, so yeah, the clay minerals, we know that the clay minerals is layered materials, layered silicates materials, which mainly consist of the tetrahedral and octahedral sheets. And there are so many types of clays depend on the arrangements of these layer sheets. But for this one, in this work, we use the smectite group, specifically the montmorillonite. Okay, so for the smectite groups, it consists of 2 tetrahedral sheets and 1 octahedral sheets, and it have because of the structure, the smectite group have the capability to be swell in the water, in the presence of water, so it can give it give the ability of the materials to release the drug that already been absorbed inside its matrix. So when we introduce the clay into the water, it can swell and it can release the drug that we have loaded into these materials. Okay, so before I'm going to the result of to the preliminary result of our work, I would like to highlight some of the findings from other study. So in these slides, we can see that the use of the clay minerals for the drug loading have been studied by many groups, one of which is by Thakur et al., where the clay mineral, the bentonite, is used for the loading of ampicillin. The clay minerals itself, of course, it can potentially bind the drug, but because of the limited binding interaction, which is maybe only the hydrogen bonding, if we use the bentonite only or the clay minerals only for the drug loading, it will give a burst effect in the beginning of the administration to the patients. So to overcome the burst effect, usually the combination of natural polymers, such as for this one is the xanthan gum and itaconic acid, can be used. So by compositing the clay, compositing the bentonite with the polymers, we can increase the active binding sites of the materials to the drug. So by inserting this natural polymer, we can see that the interaction between the vehicles and the drug molecules is more rich. We can see the electrostatic interaction, pi interaction, and also hydrogen bonding interaction. So by adding the natural polymers, we can improve the amount of the drug to be loaded into the drug vehicles. And also we can prevent the burst effect in the beginning of the administration of the drug itself. Okay, so beside compositing the nano clay with natural polymers, in some of the recent studies, we can also see the more advanced combination of the nano clay, of course, for biomedical application purposes. We can see that by combining the clay with biomaterials such as enzyme, antibody, or natural polymer, and so on, we can get responsive materials. So by combining this clay with like antibody and so on, we can make these materials to be pH responsive, ROS responsive, and so on. Okay, so in our preliminary work, we try to see the release profile of the doripenem after we load it into the bentonite, which is modified by alginate. So in this work, we are using the local bentonite from Indonesia, and then we activate it with the hydrochloric acid. And also we do the characterization to see the effect of the sodium alginate modification to the clay. And then for the drug loading study, we use the doripenem, which is load at batch absorption study at 30 degrees Celsius. And then we also see, after we load the doripenem, we also study the profile release of this doripenem. And we also do the preliminary screening regarding the antibacterial activity of this material, including the drug that have been loaded into the composite. Okay, so in this work, the bentonite is modified with the alginate. As we can see, the alginate consists of many hydroxyl group, which can help in the capturing of the drug molecules. So we can improve the loading capacity of the bentonite and also prevent the premature release of the drug. Okay, so basically for the composite, we mix the bentonite and the alginate and then cross-link it with the calcium chloride. So we have the bentonite, which is encapsulated inside the sodium alginate. So by modifying this bentonite with the alginate, we found that the surface area of the materials is increasing, but the pore volume is decreasing. So the bentonite only have the surface area around 257, and after we add the alginate, the surface area is slightly improved into 291, but the pore volume, in contrast, the pore volume is getting smaller for the bentonite alginate. And also, interestingly, we found that the addition of alginate does not cause any destruction into the mesoporous structure of the bentonite. As we can see, we can both of the materials over here have the type 4 hysteresis loop, which is typical for the mesoporous materials. So the addition of alginate here help to improve the surface area without cause any degradation on the mesoporous structure of the bentonite. And from the SEM image, we can see that there is significant alteration on the morphology of the bentonite after we modified it with the alginate. So before the modification with alginate, we can see that the bentonite have layered structure. And for the figure B is the morphology of the alginate itself. And after we combine the alginate and the bentonite, we can see the formation of pores on the surface of the materials. So we can see the macroporous structure in this composite, which maybe account for the higher surface area for the materials as revealed by the nitrogen sorption previously. Okay, so this is the pore after the pore formation after we combine the alginate with the bentonite. So the bentonite is coated by this alginate. So the bentonite is inside the alginate layer. Okay, so another characterization we made is the Xrd characterization. We found that the basal spacing is increasing after we incorporate the alginate into the bentonite. So somehow the alginate is enter the layer structure of the bentonite and cause intercalation effect like the surfactant. Okay, so for this material, the bentonite and the alginate bentonite, we try to use this material as the vehicles for doripenem, the drug for treating the infection of the respiratory tract. We found that this composite is potential as the drug vehicles for this doripenem because it can absorb. So we found that the composite can absorb doripenem at specific pH. So if we use this composite to absorb the doripenem at acidic pH, we can see only low loading over here, around 70% only. But if we increase the pH into pH 5, we can see that the absorption also increasing. So the absorption behavior of this doripenem into the composite is pH dependent, which can be related to the structure and surface charge of the bentonite alginate itself and the charge of the doripenem. So our deduction is because at pH less than 7, the doripenem is partially protonated. So it have more positive charge, which is similar to the bentonite because the two have similar positive charge. So at acidic pH, it may be there is electrostatic repulsion because of the same positive charge. So if we increase the pH, we can make the charge is opposite. So we can improve the absorption of the doripenem into the bentonite alginate composite. Okay, so Um, we try to model the absorption kinetics of the doripenem into the alginate bentonite, and we can see from this data the absorption is quite fast. That is, the equilibrium of the absorption is reached within 1 hour of the absorption, and we found it that the absorption kinetics is follow the pseudo-second order, so it gives us idea that the absorption is driven by chemosorption activity compared to the physisorption. So from this model, our initial deduction regarding the absorption mechanism of doripenem is because the absorption of doripenem is more likely because of the chemical binding activity between the composite itself and between the doripenem molecules. So our first deduction is the interaction is happen between the hydrogen group of the materials with the hydroxyl group of the doripenem. So the doripenem drug molecules is bind into the particles because of this hydrogen bonding. Okay, so we also studied the isothermal assumption to determine the maximum loading capacity of the drug into the alginate bentonite composite. And we found that the maximum loading capacity of the drug is theoretically around 50 milligram per gram. So by combining this bentonite with the alginate, we can have this maximum absorption capacity or loading capacity. But without the alginate, the data is not shown here. Without the alginate, the loading capacity or the absorption capacity is lower than 50 milligram per gram. Okay, so we also study the release profile of the drug. We still can see a little burst effect in the beginning. So we can see that the release is very rapid in between 2 hours of release, 2 to 4 hours of release. We can still see the burst effect. So in this work, we still need to find the correct ratio, or we need to find another type of natural polymer that can prevent this burst effect in the beginning. However, if we see here, if we compare the release of this bentonite alginate with the bentonite only, so the bentonite only, if we use the bentonite only for the control release of the doripenem, the release is faster than compared to the data shown here. So actually, we successfully prevent the slowdown. We successfully slowed down the burst effect of the doripenem by using the alginate bentonite composite as the drug carrier. And also, our preliminary result on the antibacterial effect, we see that the alginate bentonite composite, of course, it contains doripenem. It has quite good antibacterial activity against these two tested bacteria, which is E. coli and Staphylococcus aureus. So to conclude our work, we found here that the clay minerals is quite potential to be used as the drug release vehicle. And for the control release, we still need to find how to maintain the drug within the vehicle itself and make it more pH responsive compared to our preliminary finding over here. So that's conclude my talk for today, and thank you for your attention.